Introduction. My name is Scott Blatt, and I do own a company here in Brantford, Dynamic Ergonomics. It's a small consulting company that we do really two main things. We look at ergonomics or human factors, and we look at human performance. So most of us are somewhat familiar with the ergonomic side of things, but may not be so familiar with the human performance side of things. And that's where we're actually testing people's ability to do activities. So we actually look at the person and their function and how functional they are. With all that we do here at Dynamic Ergonomics, posture is a major component. Posture is a significant ergonomic risk factor in the workplaces. It can cause lots of musculoskeletal problems, and so it is a focus for us, both when we're assessing the individual, as well as when we're going into the workplace and evaluating the work itself. I've been doing this for, well, over 25 years now. My company's been in operation in some aspect for over 20 years. So it's been a very, very good experience for me. And I hope that what I present to you today will be a benefit to you. So why do we want to talk about posture? Why is it so important? Well, one of the main things we want to talk about is, with respect to posture, is that it does lead to injuries. It has that potential to cause harm to our bodies when we assume non-neutral positions. And what happens when we become injured, obviously, affects our quality of life. It reduces our level of enjoyment. It reduces the things that we can do, but it is also costly. If you think about all the things that you do to make yourself feel better, you think about the doctor hose and the ice packs and heating packs and the treatments that you go and to receive through physio or whatever. To have injuries is a costly thing. So if we can do some things that would help prevent it, that will also be not only better for our quality of life, but it will help us financially as well. So posture really, when it comes to injury, I just want to spend a little bit of time talking about kind of the mechanism of injury through maybe non-neutral positioning. And really, it is a cumulative disorder. So what you have is that posture, when you assume a non-neutral position, it results in us having micro trauma to the body. And this can be over a short period of time or weeks or months, but normally when we talk about posture, we're talking about it over the course of years. So the body is an amazing thing. It tends to remember the things that you tell it to do. So if you assume a non-neutral position, over time, the body then thinks that that is its new normal position. And we'll go, when we get into the presentation a little bit later on, you'll see some of these non-neutral positions that have become neutral or normal for people, but in fact, they are not. And they cause more stress on the body because it makes the body work a lot harder to do things. So let's spend a little bit of time on anatomy. Now, this is a little bit challenging. When I did these presentations live, I always like to bring people up and I could demonstrate in a live setting. So in a static presentation like this, it's a little bit more challenging. You're going to have to use your imagination a little bit and do the best you can with it. But what I want to do is just spend a little bit of time talking about anatomy so that we understand kind of the mechanisms within the spine. The focus of this whole presentation is on the spine. Now, there's lots of different posture related issues with the shoulders and the hips and the knees and the ankles and the wrists. For this presentation, because of our time, we're only going to focus in on the spine. And one of the reasons we want to focus in on the spine is that it is a major factor where people experience increased musculoskeletal discomfort. In fact, research has indicated that about 80% of the population will experience some sort of spinal pain, whether it's back pain or neck pain, within the duration of their life. And that actually increases to 90% that they'll have a recurrence. So once you get some pain in your spine, your back or your neck, you're likely to have it again. So that's the focus of today's presentation, is really on the spine. So let's spend a little bit of time talking about anatomy. So you can see from the slide here on the left, you'll see the spine. And what we have here, we have 4 curves. We have one at the neck, we have one in the back, middle, and then one in the lower back, and then our last one here down in the tailbone. Now, we're not going to spend a lot of time talking about this one down in the tailbone, or in the sacrum, I should say, simply because we can't really change that curve. Now, in the first year of life, actually, the sacrum is made up of little bones, and then they fuse together and become one bone. But once it becomes fixed and fused, you can't change it. But the rest of them we can change, and that's really where our focus will be on, is on these 3 areas. The first one is the neck. And in the cervical spine, we have 5 bones, and they're called vertebrae. And they're the building blocks for our spine. And in the mid-back, which is the thoracic spine, we have 12. And then in the lower back, the lumbar spine, we have 5. Okay. What you'll notice about each one of these spinal sections is that there's a curve to that. We have in the neck an inward curve, and in the mid-back, we have an outward curve. And again, in the lower back, we have an inward curve, okay? Those are really important. And I'm going to touch on that in just in a second. But the other thing I want to talk about, between each one of the building blocks, each one of the bones, the vertebrae, is a thing called a disc. And that disc is a shock absorber. But a really good comparison to the disc is a jelly donut. What you have is you have the pastry on the outside, and inside you have the jelly. Well, that's very much what the disc is like. You have this fibrous material on the outside, and then you have it like a jelly surface or a nucleus in the middle. And that will move, just like your body when you move forward. The disc will be compressed at the front of it, and then the nucleus inside can be moved around as well. Where this becomes problematic, because someone mentioned in the pre-session about always being bent over. Well, we live in a very flexion-prone society, which means that we're always looking down, or we're always bending forward. So we're always in a flex state. And what happens with that is that you put pressure on the front of that disc. And then that disc then puts pressure on the nucleus, which then pushes it out to the back side. And over time, what happens, the fibers begin to tear, or they become stretched. And then you have the disc will actually leak out or bulge. So disc herniation, disc bulge, slip disc, that is what happens. And that's what's occurring. Now, if we actually injured the disc itself, you would never know, because there is no nerve supply to the disc itself. So I think there's about 60% of the population actually have disc problems, but they do not know. That means they're asymptomatic, simply because there's no nerve supply to the disc. It becomes problematic when that disc touches the surrounding structure. So especially when it touches the nerve, which runs right beside the disc. And that's where we get sciatica from, or you get numbness and tingling in the arms or leg, and it can be from that area. So the disc is important because it absorbs the shock between the different vertebrae. And then beside the vertebrae, we have myofascial tissue. And that's just a descriptor that captures kind of everything. We have muscle, we have ligament, we have tendon, and that myofascial tissue is responsible for movement, but it is also responsible for making sure that the body or the spine is stable. So it creates spinal stability within the spine itself. Now, like I said, there's 3 natural curves. We have the upper back, which is curved in, which is called the lordosis. So when the curve is on an inward plane like that, that's our lordosis. The middle back is a kyphosis, which means we have an outward curve, okay? And then the lower back again. Now, the importance of the curve is architecturally, that's a very strong structure. So if you think about a bridge and how a bridge is built, it's built in an arc. And the reason for that, it's very strong structurally. And that's the great thing about the spine. is that with those natural curves, it's very structurally strong. It's got to bear the whole weight of the body through that. The other thing it does by having those curves in those specific directions, it allows us to have a lot of movement. And that's important, obviously. We need movement to do activity. So those three curves allow us to move about. And we're going to talk a little bit about how those changes to the curve can be negative. So let's spend a little bit of time talking about good posture. And I will say this, one of the things that it's been a while since I did a presentation in this format. And so I hadn't actually did the exercises myself. And what I realized when doing some of the exercises that some of my posture has changed, and we'll see that in some of the pictures that I'll show. So I'm kind of preaching to the choir because I need to make some changes myself. So anyways, what we want to look for when it comes to neutral posture is we're looking for the ears over the shoulders, okay? The shoulders should be kind of in line with the elbow and then over the hip. The chin should be parallel to the floor, okay? The shoulders should be back and relaxed. There should be the knees should be not locked, but not flexed either, okay? And then the other thing is the muscles, the core muscles should be engaged. And that will keep us into neutral posture, okay? What's poor posture? Now, looking at this picture right here, you're probably thinking, well, he's forcing that posture. When in actuality, what I really did is I disengaged my muscles. That means I relaxed. When I totally relaxed, this is what happens. The muscles are responsible, like I said, to hold the body in that nice upright position. And when you disengage, what happens then is that you're relying on your ligaments. And a ligament is not is the structure that goes from bone to bone. There's no muscle attached to that. It's like a guide wire. It holds the structure in place. So you hinge on those ligaments. And after time, those ligaments become stretched, okay? And like I said, the body will tend to remember the position you put it in. So if you stretch those ligaments enough, what will happen then is that you create laxity within that joint, because that when you put that joint back into neutral position, that ligament remains stretched. So the joint becomes kind of sloppy. Now, we're not talking huge movement within the spine, but even a little bit of movement, which creates laxity, which creates spinal instability, which can create pain. So that's why posture becomes really important because it can be painful, right? By having simple non-neutral positions. So what we can see from this picture right here is that the ear is now slightly in front of the shoulder. We'll see that the curve in the back is increased, okay? The other thing that you'll notice about posture, okay, if you compare the previous slide, right? If I just go back quickly to that, and you look at that, and I'm not trying to talk myself up at all, but that looks pretty good, right? I look at that and I think to myself, I look pretty good there. And then I go here and go, I don't look very good there. So that's one of the things about posture. It actually makes you look better, okay, by assuming a nice neutral position. So if you have a wall space, now I didn't kind of provide a proper preparation for you because I'm doing a couple different exercises in this presentation today. And the important thing here to remember that if with any of the things that I'm going to show you today, if you have any kind of musculoskeletal pain, aches, or any changes during these activities, please stop. Please consult a healthcare practitioner. So there's a little bit of disclaimer I want to provide right now that you're free and welcome to do these, but use them or do them at your own discretion. And if you do have any changes in how you feel, please stop. Now, this video will be provided later on the website. So you can go back and do it at your own pace, review, rewind, stop, and then kind of practice to see how it feels. So the activity that I would like people to try, you can just, like I said, you can just look at it today, and then maybe later on, you can actually be more active and try it. is you're going to stand against the wall, okay? And what you're going to do is you're going to put your lower back and your shoulder blades against the wall. You can see here in the picture that my spine is kind of in alignment with the wall. And then what you want to know is you want to take note of the space or the gapping that's between your head and the wall, okay? What there should be is there should be no gapping. It should be like this. Now you can see from here, I don't look very comfortable moving into that position. This is actually neutral posture, okay? This is where our head, our shoulders are over, our ears are over our shoulder, our head is in line with the spine. And you may feel some discomfort and some pulling in trying to get into this position. When doing this activity, what's really important is that you do not elevate the chin. That means don't lift the chin up, don't lift the chin down. The tendency would be to be moving upward. And that's because these muscles have become tight. They become used to the position that is not a neutral position. And so it's important that when you actually do this activity is that you go straight back. And it's always helpful when you have someone who can watch you do this activity so that you make sure you're doing it properly without assuming another non-neutral position, which would be a neck extension. Neck extension is not an activity that we want to do for any length of time. So we want to actually what they call, it's called retraction. We want to retract the chin back so that we assume this more neutral position, okay? And like I said, this is actually how we should be standing all the time, but it is good biofeedback. It's going to give you some feedback of what you should be in space, but it can also be used as a corrective mechanism. That means you can train yourself, retrain the position of the neck and the spine simply by doing this activity. Now you can do it on the floor as well. You can get a little more gravity assistance with this, but it is better to do it on the wall, but you can start with it on the floor if it's easier to get on the floor. Now it has to be a hard surface though. You can't do it in a bed or on a couch or a sofa or anything like that. It has to be on a surface that's firm, that's going to support the spine when you do it. So working postures, this is coming directly from the ergonomic world. They have established the optimal working heights. And I'm not going to spend a lot of time on this today, simply because I want to get into another activity and I don't want to take up too much time, but this is a really good guideline for people who are trying to figure out what height should I be doing my activity at so I assume a more neutral position. And that's exactly what this picture will illustrate. So you can see that there's different type of activity, precision work, light work, and then heavy work. And it's all based on our elbow height because activity we do usually is in reference to the elbow. So precision work, we want higher because typically what we're doing is we're doing fine motor skills. We need good vision and we're not using a lot of physical force. So the higher up it is, the better it is because it reduces the amount of trunk flexion, it reduces the amount of neck flexion, and it just makes it easier for it to do that work. Now, when you're doing lighter work that maybe involves a little bit of physical exertion, but not a lot, a little bit, we want a little bit lower so that we can use the body weight assist to do the activity. But we don't want it so low that we have to bend over because we need to see the activity as well. And the next one is when we're doing heavy work, more physically demanding activity. We're going to have that a little bit lower so that we can add even more body weight assist in performing that activity. And it's the same thing when it comes to reaching. So that was actually the vertical height we want to reference. And this one is about horizontal distance. Because what happens when you work away from your body, I don't know if you've ever been doing an activity and then you're sore afterwards and you go, why am I so sore? And then you realize is that you spent all that time reaching across to do something. And then you make a small adjustment by bringing it closer or going to the other side. You go, wow, did that ever make a difference? And that's really what we're talking about here, is keeping activity within our reach envelope. So normally what I like to tell people is it's kind of like the windshield washer effect, but with our elbows. So if you put your elbows against your side, maybe slightly in front of your body, and then you just move them back and forth, okay? I don't know if you can see, but basically what I'm doing is this type of activity, but with my elbow in resting position. That's the kind of the reach envelope you want to stay within, because that's going to make sure that you're not flexing forward or you're not reaching forward. And that's what this picture is kind of illustrating here. This is the primary area of reach, and then this is the secondary or tertiary area of reach. Now, this is a video that I wanted to show, and I was hoping it was going to work, but we're having some audio problems with the video being transferred through the presentation. So we're going to try to walk through this and talk through it at the same time. So this is where you get your broomstick. And so if you want to do it, great. If you want to, once again, you want to wait, you just want to watch right now, and then maybe come back later on and observe and kind of practice, that's great. It's about doing, so everything we talked about so far is about static posture, you know, standing upright, ears above the shoulders, shoulders above the hip, hip above the knees. That's a very static position, but it's not very practical. How do we take that practical aspect of good posture and apply it to our everyday life? And what I wanted to show you is how to keep neutral position no matter what we're doing. I'm not going to go through every single scenario because it's way too difficult to do that. What I really want to try to instill with you guys today is how to assume neutral posture, what neutral posture is, how to do it, and then apply it to any situation. And that's really what I'm hoping to do here. So let's give this a go and we'll see how it runs here. So this is the broomstick that I had selected. And just hang on, there we go. All right, so I just gave the rundown. I basically just said the same thing. And once again, I just want to reiterate that if you have any musculoskeletal discomfort during this activity, please stop and then consult a medical professional. Now, it's very important that when we're doing this type of activity is that you really pay attention to the contact of the broom with your body. And we're going to find that when I'm going to show the video is that there's going to be 2 points of contact. One is going to be in the upper back, and one is going to be down and kind of be in between the buttocks or the tailbone. And it's really important that you keep those points of contact throughout the entire movement. That's really the crutch of this all. And what you're going to see here is I'm holding the broomstick with my left hand, but my actual preference would be to hold it with I'm going to be holding the broomstick with my right hand, but my preference would be to do it with my left. The reason I'm doing it like this in the video is simply because I want to make sure that you can see what I'm doing here. And right here, you can see the curves. So here's my curve here, and then here's my other curve here. These are the 2 curves that we're really going to focus in on. Now, you can see the spacing between my head and the broomstick. There's quite a bit there, right? And that's because I have that forward head posture, that forward head carriage. And what I've really noticed in the last 2 years since COVID started, and then we've been kind of relegated to home, and I spend a lot more time on a computer, you know, doing Skype meetings and virtual assessments, and I'm not in person as much. And I've spent a lot of time on my laptop and on my phone. And I'm strongly convinced that that's a contributory factor to this. Now, of course, there's going to be lots of other factors that go into it, but this space in between here and here is not optimal. Now, what you're going to see, like I said, there's 2 points of main contact, and ideally 3 if you can get your head back there. But the first point of contact is here at the buttocks. The next point of contact is here in the mid-back. And what we're looking for is that these points of contact do not change. So as you bend, you have to train yourself so that those contacts stay. And what you don't want is you don't want to bend over. See here where I'm bending over, where the points of contact. See the spacing happening here? I only have one point of contact now. And this is how we normally bend. Is we just bend over, we lose this point of contact, and we only have this point of contact. And what you're doing is you're loading up that lower area. The weight or the force that's being generated with bending is now being put here rather than being equally distributed. Now, when you want to get lower, obviously you're going to have to bend your knees, have a nice wide stance, and then you move through. So this is, and once again, I'm showing you how most people will typically bend. And this is what I want to show you how you should be bending, is by keeping the points of contact, the 2 points mainly. There can be a third one as well, okay? So taking that information and then moving into another more practical area is keeping is lifting. And you can see from the previous video that a nice wide stance, keeping the back straight. Now, when we say keeping the back straight, it doesn't mean the back is going to be perfectly vertical. This is actually, the back is still straight. It's about the 3 natural curves. It's really what we should say when you say keep your back straight. It's just keep the natural curves. That's what you want. By keeping those natural curves, you're keeping your spine in a neutral position, reducing the risk of injury. So it doesn't mean moving up and down in a vertical position. It's more about neutral position of the spine. And you want to keep a nice wide base, okay? And then you're gonna move through that with the kind of the posture that I demonstrated with the broomstick. Really what I want you guys to take away from here today, if you take anything away from this session, is really about the exercise with the neck and the exercise with the broomstick, because those activities are the ones that are going to train you to be in a neutral position. And you can use them as a benchmark. You can try to do the neck exercise, and if there's lots of gapping there, okay, but then you consistently work at trying to reduce that spacing between your head and the wall, and then you're conscious of all the activity that you do, trying to reduce the amount of neck flexion. So rather than having things down low, you bring things up higher. So you reduce the amount of neck flexion, as long as your hands don't have to interact with the activity. So reading a book, looking at a phone, looking at an iPad, those types of things, try to bring that up, okay, and separate, you know, your input device. So if you're using a laptop or something like that, you actually want the laptop keyboard lower, but the actual display up higher. So you want to keep that so that your head isn't always looking down. And similarly, when you're looking at activities when it comes to the lower back, obviously, you know, for example, doing dishes out of sink, you know, it's very for us just to curve our back, to hunch over to do the sink. Whereas if you actually change this subtly, you actually engage the core, you flex through the pelvis, and you actually try using the broomstick at the kitchen sink to try to keep those nice neutral positions. It's about training yourself. Most of us have been doing things for a long time in a certain way, and they may not be the right way or necessarily the optimal way for your body. So you have to kind of recondition and retrain yourself, and you'll need some external input in order for you to understand the possible changes that may be occurring when you're doing an activity. So I would encourage you to use that broomstick activity and the neck exercise as feedback as to what your posture is really like, but also as a training mechanism for yourself. We have a saying in the ergonomic community, and it is next posture is the best posture. And that means continuous change. And so when it comes to posture, one of the things that contributes to the likelihood of it causing discomfort is that we keep on holding that non-neutral position. So it's really important to move, you know, and that's how actually the spine gets its nutrients through movement. So if we remain in a very static or sedentary position, the risk of harm coming from posture increases. Now, does that mean we will incur some kind of ailment? No, but the risk increases. So movement is really important. Obviously, movement is really important on a multitude of levels, but definitely from a musculoskeletal perspective. I do have some exercises, some further exercises on my website. If you go to my website and it's called Your Aching Back, you'll see an exercise there, those 3 exercises, and they're designed to improve back function. So if you want to take a look at that, you're more than welcome to. And that concludes my presentation.